So my name's Andrea. I'm a nurse at Rush University Urology, and I'm going to be talking to you today about biomarkers and prostate cancer. So my objectives for you today are to be able to discuss new biomarkers that are available for assessment of prostate cancer risk. So do you need to biopsy your patient to begin with, and/or do they need an additional biopsy after having a negative biopsy? To be able to list the biomarkers for predicting aggressiveness of prostate cancer. So now your patient has cancer. Do they need treatment? Can they do active surveillance? And then to list the genomic evaluation of recurrence risk following definitive surgical therapy. So after their prostate's been removed, do they need radiation treatment? Do they need androgen deprivation therapy? To obtain credit, you must be present, complete the evaluation form, and return that to the staff. So it's far more important to know what person the disease has than what disease the person has. With today's technology, we can actually open up DNA and RNA and look inside a specific person's biology, which can vary greatly. You have one patient with the same Gleason score, same TSA, same clinical presentation, but one of those patients will take a course where they become very ill and the other will not. And this can help fill in the gaps on that knowledge. So what are biomarkers? According to the National Institute of Health, it's a characteristic that's objectively measured and evaluated as an indicator of normal biological processes, pathogenic processes, or pharmacologic responses to a therapeutic intervention. So this could be something as simple as a pain rating scale on a 0 from 10, or as complicated as genes fusing together in the presence of prostate cancer. So genomics and genetics, sometimes people think that they are the same thing. They're similar, but not exactly the same. Genetics is the study of heredity or one single gene, whereas genomics is the study of multiple genes and their functions. So most of our tests we'll talk about today, they're looking at panels of genes. So personalized medicine is a newer buzzword that you may have heard, and this is a form of medicine that uses information about a person's genes, proteins, environment to prevent, diagnose, and treat disease. So in cancer, we can use specific information about a person's tumor to help diagnose, plan treatment, or to find out how well a treatment is working, or to make a prognosis for the patient. So why should we use biomarkers? Well, we need to prevent unnecessary biopsies. Depending on what study you're looking at, the incidence of infections can range from 0.1% to 7%. One study showed 4% of men are hospitalized following a prostate biopsy, and 75% of men with an elevated PSA don't even have cancer. We also need to prevent overtreatment. There's one study showing 30 to 40% of men who were treated for prostate cancer likely had indolent or slow-growing disease that would have never threatened that man's life. You can also use these tests for pre- or post-surgical considerations, so your physician's nerve-sparing technique and/or a degree of lymph node dissection. It also helps support shared decision-making process. This is supported by the American Urological Association, and it's been found to increase patient satisfaction, cause less decisional conflict, support patient engagement, and also help support personalized medicine. So it can really help you and your patient sleep better at night with the decisions that you've made on their plan of care. So here's our outline. We're going to talk about a lot of tests today, so I'll move quickly so we can get through all of these. Our clinic is currently using all but 2 of these tests here. So first we're going to talk about the assessment of prostate cancer risk. So your patient comes into the clinic, maybe they have a family history of prostate cancer, maybe they have an elevated PSA or a suspicious digital rectal exam, and you want to take a further look into their risk. So the first thing that we'll talk about is PCA3. And I got a little picture of the urine cup up there, so this is a urine test. So you do this urine sample after a digital rectal exam. The digital rectal exam will help push some of the cells into the urethra, and then the patient will void the first 20 to 30 milliliters, which will capture that genomic information. It gives you a score ranging from 0 to 125. 0 is good, 125 is bad, and it assesses for significant prostate cancer. They're also using this for active surveillance. So here's an example of some test results that you may receive for PCA3. So the general cutoff score here for biopsy is about 25, and then in the use of active surveillance, I think their cutoff score is around 60. That may vary based on what source you're looking at. So patient selection. This is very important for nurses and staff that work in the clinic, because the physicians will say, hey, I want this, but it's up to you to figure out, can you order this for the patient? So you can order this for a PSA between 2.5 and 10. They can have prostate cancer or not have prostate cancer yet. If the patient has had any surgical procedures or anything in the past where you can't do a digital rectal exam, then you can't order this test. With validation, I'm not going to talk about every one of these slides here, but validation studies are done to make sure that the test is reproducible in the laboratory, that it's good to be used in the clinic, it's actually changing the course of the patient's treatment plan, and that it's actually measuring the outcomes that you want it to measure. So this is some validation for PCA3. So to order this test, the provider will come in and perform a digital rectal exam. You'll collect the first 20 to 30 milliliters, and my tip is to always mark the cup with a Sharpie, because some patients think if 30 milliliters is good, then 60 is better. But that's not the case, because it'll actually dilute your sample and they won't be able to run that. You'll invert the sample a few times, you transfer it into the tubes, and then send it as soon as possible to the laboratory. It's faxed back to you within 1 week. Cost is around $200. It's difficult for me to comment on all of the insurance aspects of all these tests, because it's really a moving target. It varies by region. But the cost here is $200. So now we'll talk about my prostate score. This is out of the University of Michigan. We call it MIPS. And this is also a urine test done after a digital rectal exam. So it combines 3 different biomarkers, PCA3, which we just talked about, plus the TMPRSS2 and ERG, also known as T2-ERG. And these are 2 genes that fuse together only in the presence of prostate cancer, plus your serum PSA. So they combine these 3 different biomarkers, use an algorithm, and then they give you a score which will give you the % risk of any prostate cancer, and then your % risk of high-grade prostate cancer. So by high-grade, I mean Gleason 7 or higher. Here's an example of some test results on a PCA3. So you can see that his PSA is 17, which is pretty concerning. However, the PCA3 score is only 10. Remember, your range there is from 0 to 125, so he's well below that cutoff range. And the T2-ERG score ranges from 0 to 1,000, and it's 0 for this patient. So this may be someone where you can avoid doing a biopsy for. And then they give you, in the blue, you can see their risk of any prostate cancer, and then in the green, the risk of high grade. So you can order this on a patient with any PSA level. If they've had a positive biopsy in the past, it's not really been studied yet for active surveillance, although they are looking at that. If you can't perform a digital rectal exam, you can't do this test, and if the patient's already been treated, you can't run this test either. Here's some validation for MIPS. So to complete the order form, you need to include a recent PSA, and a recent PSA means within the last 6 months. Provider will perform the DRE. Again, mark your cup. We've had several tests canceled because of a patient giving too much urine. So it will be the first catch of urine from the patient. So make sure they come into the clinic all the time and they're doing the clean catch. They're wasting the first amount. It's a little bit confusing. Make sure they don't waste that first amount, because that's the urine that you need to test. It must be on ice. So when you have these tests in your clinic, I would suggest taking the ice packs out immediately and putting them into the freezer, because they have to be frozen for 24 hours before you can send them out. You actually FedEx it right to the University of Michigan laboratory, and the results are faxed back to you within 7 to 10 business days. The cost is $723. Illinois Medicaid is not covered for this. So some of our patients have paid out of pocket for it. Some people can't afford that, but that's something to keep in mind for this test. Now we'll talk about Select MDX. This is another urine test here. So again, physician does a digital rectal exam, and then they take a look at 2 different biomarkers that are associated with high-grade prostate cancer, and it'll give you the % likelihood of prostate cancer on biopsy and the % likelihood of that being high-grade prostate cancer. So here's an example of some patient's results. So this patient has a 57% likelihood of prostate cancer upon biopsy, and then a 50% likelihood of that being high grade or Gleason 7 or greater. You can run this test with an abnormal or normal digital rectal exam, any PSA. Again, you can't do this if you can't do a digital rectal exam. Here's some validation for Select MDX. And to order this form, to order Select MDX, you need to complete the order form, including PSA, DRE results, family history of prostate cancer, and the prostate volume. Again, it must be the first 20 to 30 milliliters. You'll mix up the specimen a few times, transfer that into the tube, and then you're going to ship it same day, room temperature. And they have nice kits that they can provide to your clinic for all these tests. So you can send those out. Results are faxed back within 5 business days. The cost of this test is $500, and the company MDX Health offers payment plans for patients. They can also help with appeals if the insurance company has denied the claim. All right, now we're moving into the blood test here. So 4K score, this looks at basically 4 different variations of PSA that are more specific to prostate cancer. So then they use that in an algorithm. So you can see here on the your left-hand side, it combines total PSA, free PSA, intact PSA, and then the human callichrin 2. The intact PSA and the human callichrin 2 are proprietary tests for 4K. And then they combine that with the patient's age, their digital rectal exam results, so either suspicious or not suspicious, and then if they've had a prior negative biopsy or not, they put that into an algorithm that gives you your 4K score. And it gives you the % risk for aggressive prostate cancer only. That one piece there. Plus the likelihood of distant metastasis within the next 10 years. So here's an example of some patient results. So on this order form, it was marked that they didn't know what the digital rectal exam results are, so they're going to give you 2 different ones. So your score on the top here is if the DRE is abnormal, so it's at 9%, and it gives you 3 different colors here to follow. Green is okay, probably you don't need to biopsy that patient, and then yellow is maybe thinking about a biopsy, red is suggested for a biopsy, and then on the bottom it's 7%. So that's for a patient with normal digital rectal exam. You can order this test on any PSA. They can have an abnormal or normal digital rectal exam. You can't order this test if they've already been diagnosed with prostate cancer. And since it is a PSA-based test, you want to avoid anything that can alter their PSA levels, such as digital rectal exam, BPH treatment, prostate biopsies, 5-alpha reductase inhibitors, or recent catheterization within the next 2 weeks, or within the last 2 weeks. Here's some validation for the 4K score. So to order this, you'll draw the blood. You're going to invert that a few times, and then you need to let it stand for 20 minutes, and then centrifuge that for 10 to 15 minutes. When we started doing this test, we did not have a centrifuge in our clinic, and the company will actually provide that to you free of cost if you need that. And then you're going to pack according to specimen instructions. This one also must be on ice, so make sure you take that ice pack out and put it in the fridge. We actually label ours, 4K, Apifiny, whatever the test is, because they're a little bit different sizes, and I found that you can't use one for another. It won't pack correctly. So it'll be FedEx to the GenPath lab, and then you'll get the results within the next 3 days. It's usually a 48-hour turnaround via fax. The cost here is $1,900, and the company does offer some programs to help patients who may need financial assistance. Prostate Health Index, also known as PI, we'll talk about next. Is anyone currently doing this in their clinic? Okay, we aren't either. So this combines PSA, free PSA, and the Pro2 PSA. They plug that into a fancy algorithm here, and it gives you a score between 0 and 55, and it falls within 4 different risk categories found on biopsy. So you can see here all the way to the right, it'll give you the patient's prostate health index range. There's 4 different categories based on the numbers that you get back, and then it'll give you a % probability of cancer. You can order this on any PSA between 2 and 10 if they have a negative digital rectal exam. If their digital rectal exam is suspicious, then the patient's not a candidate for this test. And then you shouldn't do anything that might affect their PSA level, like a recent digital rectal exam, prostate biopsy, treatment with 5-alpha reductase inhibitors. Here's some validation for the Prostate Health Index. So to do this, you're going to draw blood. You'll let that stand for 30 minutes, and then you also need to centrifuge this. And then you'll ship it the same day, FedEx it right to the lab. The results will be sent back to you within 3 days. The cost is $499, and it's done at only one laboratory right now, the AccuReference Medical Lab. Okay, our final blood test today we're going to talk about is Apifiny, and this is a blood test that measures 8 different biological markers associated with an immune response. So these are autoantibodies that they're looking at. So it's not related to PSA whatsoever. So the patient has prostatitis, if they have an indwelling catheter, if they just had a prostate biopsy, they're still a candidate for this test. It'll give you a score between 0 and 100, and it gives you a cutoff score. It's either low risk or high risk. Here's an example of some patient results. So you can see the little tiny X there within the box. This shows that the patient falls within the lower risk. Their cutoff score is 59. So anything above 59, 1 out of every 3 patients in that category are diagnosed with prostate cancer, and if they're low risk, it's 1 out of every 10 patients that have been diagnosed with prostate cancer. So you can order this if their PSA is greater than 2.5. You can't order this test if the patient's immunocompromised, because this is measuring an immune response. So if they're taking steroids, or if they're HIV positive or severely immunocompromised, you can't order for that patient. So to order this, you'll need to draw blood. Don't use any needles smaller than 23 gauge. That can actually break up the cells, cause hemolysis, and can affect the results of the test. And then you need to FedEx these or UPS them Monday through Thursday. Don't send them out on a Friday because they'll sit for the weekend and may get too warm. May have to cancel the test in that case. The results are faxed back to you within 3 days. The cost of this test is $705, and this company also helps patients who need financial assistance. So the final test we'll talk about today is Confirm MDX. And this is for a patient who's already had a prostate biopsy. I put a little picture of the tissue up there so you know it's a tissue test. So if you have a patient that has a negative biopsy, but you're still suspicious that maybe you missed something, or maybe it was a 12-core, you can order this, and this detects changes to the DNA in a methylation process. It's known as an epigenetics assay, and it actually creates a halo or a field around the area of prostate cancer that can be measured. Then they combine PSA, digital rectal exam, age, and then histopathology. So it's either positive or it's negative. If it's positive, they'll give you a % likelihood of any prostate cancer. Then they break it down into low-grade or high-grade prostate cancer. So here's a picture kind of what that field looks like. So basically the prostate cancer is preparing space to spread. And in that process, it starts turning off genes. Those genes are helpful to the patient, and the cancer doesn't like that, so it turns those genes off. So they can measure the methylation, although it looks regular, looks normal under the microscope. And these are the 3 different genes that they look at. And then, turns the genes off there. This is an example of patient results. So you can see here the likelihood of prostate cancer on repeat biopsy, 38% low grade and 50% high grade. And at the bottom, they'll actually show you the areas of suspicion while that methylation is happening. So if your physician wants to go back in and rebiopsy, they can actually target these areas. You need at least 8 cores to run Confirm MDX. So you can run it if they have high-grade PIN or any atypia, benign. You can order it for a normal or abnormal digital rectal exam or any PSA. You can't run this on a positive biopsy, and the specimen can't be older than 30 months. Here's some validation for Confirm MDX. So to order this, the patient has to sign a medical release form. That's really important. That can be a big problem if you forget to have them sign that medical release form before leaving clinic. Then you have to call them and figure out fax machines and all that. So always have them sign a medical release form. And then you're going to complete that order form with their PSA, DRE, age, copy of the path report, demographics, insurance. Send that off to MDX Health. And then those results come back within 7 to 10 business days, according to the manufacturer, but I think they're running a little bit behind now. It's been taking about 4 weeks for these results to come back. And they always, whenever you're sending off tissue for prostate biopsies, they always send it back to the original pathology department. The cost is $3,300. They do offer payment plans. And if the out-of-pocket cost exceeds $500, they'll actually call the patient and ask for their permission before they run the test. So now we're going to move on to the next category. So now your patient has prostate cancer, and you're trying to determine, can they go on active surveillance, or do we need to do something now? So in the NCCN guidelines in 2016, they added a footnote here that men with clinically localized disease could consider the use of a tumor-based molecular assay to stratify better risk of adverse pathology at radical prostatectomy, or chance of biochemical recurrence or disease-specific mortality after radical prostatectomy. So we have 4, oh, by the way, these are in no particular order whatsoever. I mean, I could have at least done alphabetical, but didn't even do that. So first we'll talk about Prolaris. And this, again, uses prostate biopsy tissue, and it measures the aggressiveness of an individual's prostate cancer by looking at gene expression of 31 cell cycle progression genes, and that just tells us how quickly the cells are multiplying. And then what we mean by housekeeper genes, it's sort of the control for the test to make sure that everything's measuring correctly. So the Prolaris score ranges from 0 to 10, and an increase in 1 unit doubles their risk. They also give you 10-year prostate cancer specific mortality by combining the Prolaris score with the Capra score. So here's an example of patient test results. So it's characterized as a percentile distribution within the AUA, different categories there. So you can see that this patient is less aggressive than average AUA, low risk. And then at the bottom, they have their risk of mortality, which is 2%. And your general cutoff for concern there is actually 3%. So this patient may be a good candidate for active surveillance. You can order this test on any patient with a PSA less than 100, any Gleason score. You need a 0.5 millimeter of tumor. They can combine multiple cores. For these tests that look at RNA and DNA, sometimes you get cancellations if there is not enough RNA to work with. You can't order it if they've already had, treatment with androgen deprivation therapy, radiation therapy. Again, if their RNA is degraded, I found out that the RNA can be degraded due to processing. So if they take too long exposing the specimen to air, or the type of fixative that they use. I think St. Anthony's is using something called Boyan's solution, and that actually degrades the RNA. So we haven't been able to get any results from St. Anthony. You cannot order these tests on TERP specimens or a specimen that's older than 12 years. Here's some validation for your Prolaris score. The patient must sign medical release form, and then you're going to complete that order form. And for all of these order forms, we keep electronic versions and we pre-fill our physicians. That'll help things go a little bit faster for you. And you're going to either send that via email or fax that out. The results will come back within 2 weeks. Specimens always sent back to the original pathology department. They do have a lot of these companies have online portals. I would suggest signing up for them if you can, because you can actually look and see if the specimen's been received at the lab and an estimated date on when the results will be back. So that can really help you with scheduling follow-up for these patients. The cost of this test is $3,400. They do have a Myriad promise. So if their out-of-pocket expense exceeds $375, they will not process that without the patient's permission. And they offer financial assistance programs as well. So next we'll talk about OncotypeDX. Again, this is another tissue-based test. It measures biological aggressiveness by testing 17 different genes associated with adverse outcomes, and it looks at multiple biologic pathways. So it looks at 4 different pathways with one pathway or one grouping as a reference or your control. And the results will give you a score ranging from 0 to 100. 0 is good, 100 is bad. So these are the 4 different pathways that it can follow. So stromal response and proliferation are associated with bad outcomes, and androgen signaling and cellular organization are associated with better outcomes. Here's an example of a patient test here. So they use, unlike Prolaris uses the AUA, Oncotype uses the NCCN. So first they'll show you where your patient is within the NCCN risk category. So this patient was in the low category. And then when you add that biological information in, this patient was actually recategorized as very low. So this patient may be a good candidate for active surveillance. And sometimes we see that go from low to intermediate, and that helps us make a decision on treatment for the patients. So you can order this on any patient with a PSA of less than 20. Their Gleason score should be 6 or 3+4 in less than 3 cores. So for this test, they have a modified intermediate NCCN category. So you can't order this on anyone. So you can only have 3 3+4s or 1 4+3 for these patients. They need 1 millimeter of tissue. They really want the patient to be diagnosed with cancer within the last 6 months, although they will still run tests up to 3 years old. Let's see, 3+4. You can't order this test if they've already been treated with androgen deprivation therapy, radiation therapy, if their RNA has been degraded. Can't order it on TERP specimens if there's any atypia or specimens greater than 6 months old. I should say, you can order it with atypia, but they have to have a positive core as well. Here's some validations for OncotypeDX. These are the different NCCN categories. They do have a modified NCCN intermediate risk here at the bottom. So for your high-risk patients, they don't qualify, so you can't order this on a Gleason 8. So again, they need to sign the medical release form. And this is the only test that you can actually do everything in an online portal. So you can do all of your ordering and resulting, print them out. You can see all the tests that you've done, when they've been received in the lab, and the estimated date that the results will be back. So you're going to send that with the path report, demographics, copy of insurance to Genomic Health, and then the results will come back within 14 calendar days. Specimens always sent back to your original pathology. So the cost of this test is $4,520. They have a GAP program, so if the patient's out-of-pocket expense is greater than $100, then they'll actually call the patient to make sure that they're okay with paying that amount of money for the test. They do have patient assistance plans and payment plans. Okay, Decipher is our next test here. So this uses, again, prostate biopsy tissue. This measures the expression of 22 RNA biomarkers that follow multiple different pathways. This test is completely independent of any PSA, so they don't plug any of that information in for an algorithm. It's strictly the biology information that they get from this test. So your score ranges from 0 to 1, and it falls into 3 different categories: your low risk, average risk, and high risk. It'll also predict the likelihood of metastasis within the next 5 years if they're not treated. High-grade disease, so that any Gleason 4 or 5, and prostate cancer-specific death for men diagnosed with localized disease. These are the different gene categories if you're interested. Here's an example of some patients' results. So their Decipher score was 0.70. You can see that they're in the red zone there, and they're within that high risk. So you may want to encourage this patient to seek treatment and not active surveillance. So you can order this at any NCCN category, any Gleason score. You do need 1 millimeter of tissue, and it needs to be 25% positive. Any PSA goes. Can't order it if they've already had treatment with ADT or RT. The RNA's been degraded. Can't order it on TERP specimens, and you can't order it if they only have atypia. Decipher Grid is something interesting that GenomeDX is doing. It's free for patients, and they're actually collecting all of this biological information into a gigantic database, and that can be used for researching, finding new biomarkers, and it can also be used in the future to help your patients with treatment. So it'll give you a printout showing you what different genes are overexpressed or underexpressed for your patient. So if they develop metastasis, let's say 5-10 years from now, and you're not sure how to treat them, or the oncologist isn't sure how to treat them, you can actually pull this grid information back out and say, take a look at that information to help guide treatment. They're coming out with a newer version, I think, pretty soon as well to give more information. Here's some validation for Decipher. To order, again, you must sign the medical release form, complete that order form, fax everything in, including pathology, demographics, and copy of insurance, and those results are reported within 14 calendar days. They don't have an online portal yet. They're working on it, though. The cost of this test is $3,000. They do have a nice patient care program. Their maximum out-of-pocket is $100. So if even if insurance says we're not going to pay for it at all, they will appeal it twice on the patient's behalf. And if they still don't cover it, they're only going to charge the patient $100, which is really nice. So they offer financial aid, payment plans. All right, last test we'll talk about in this category is ProMark from Metamark Genetics, and this uses prostate biopsy tissue. It looks at 8 different proteins. Score ranges from 0 to 100. It'll give you % risk of aggressive disease and % risk of aggressive disease within different NCCN categories. And these are the 8 different biomarkers that it takes a look at, and then what those expressions mean on the right-hand side if you're interested in that information. So here's an example of some patient test results. The cutoff score here is about 27%. And so this patient, they got nice, I like the colors. It's easier to understand. So he's in the green zone, so he's good. And then if you want to add in some information about the NCCN risk categories, you can actually do that. You can see at the bottom they have a small graph there, so you can add that information into the equation. You can order this on any PSA. You cannot order it if they have a prominent Gleason 4. Here's some validation for ProMark. Order this, must sign medical release form, and you're going to complete their order form, fax that in with the demographics, copy of insurance to Metamark Genetics, and then it's reported within 7 to 10 calendar days. So the results will be received via fax. The cost of this test is $3,000, and they do offer patient assistance programs and payment plans. Okay, so now we're moving into the next category. So now your patients had definitive treatment, so they've had a prostatectomy. Now, do they need to have more treatment, or can we just monitor them? So there's some tests available for that. So we'll start with Decipher. So they have both. They have the biopsy test and the post-prostatectomy. I have a picture of the Da Vinci down here in the corner. So it uses specimen from radical prostatectomy. And it's important to tell your patients that when you go in and tell them we're going to order Decipher to see if you need maybe a little bit more treatment. They get really scared because they assume that there's going to be more needles and more pain involved. But these all are run on tissue that we already have. And then this predicts risk of metastasis after having a prostatectomy. Gives you your score from 0 to 1 with 3 different categories. And it also gives you the % likelihood of 5-year metastasis if untreated and 10-year prostate cancer mortality if untreated. These are the different gene categories. So 2 different patient examples here. So on the left-hand side, you'll see a patient's had surgery and you order a Decipher for them. It comes back high risk. They may need early radiation therapy treatment. So as soon as you see that PSA rising, you want to get them in to see the radiation oncologist right away. And then if patients post-surgical and they don't have any rising PSA, they come back as low risk, then that's a good candidate to just continuing monitoring their PSA. On the other hand, you have a patient who's post-prostatectomy. Now they're having biochemical recurrence, so their PSA is starting to rise, and it comes back as high risk. We send these patients right away to radiation oncology physician with their Decipher results, and they'll be recommended for radiation treatment, an intensified program for that. And then if they come back as low risk, then maybe you can just do radiation therapy alone and avoid that hormone therapy piece. So this is an important tool. All of these are important tools for your team to make decisions on patient care. So the patient selection for this, basically they have to be characterized as like a high suspicion level of their pathology report. So only scenario where you would not want to order this test is if they had a Gleason 6 organ confined. Insurance may not pay for that, although Decipher will still run it if you're interested. You can't order this test if a patient's already had androgen deprivation therapy or radiation therapy, and sometimes we have issues with the RNA being degraded. Here's some validation for Decipher. Patient must sign medical release form. You're going to complete that form with all of their path report demographics, send that into GenomeDX. The results will come back to you within 14 calendar days, and they always send the specimen back to the original pathology department. The cost is $3,000. Just like the biopsy Decipher, maximum out-of-pocket of $100. They offer a lot of payment plans and financial assistance for patients. And the final test that we're going to talk about today is the Prolaris post-surgical. So again, this uses prostatectomy tissue, and it measures the aggressiveness by looking at 31 cell cycle progression genes. So how fast are these genes replicating? And it gives you your Prolaris score, ranges from 0 to 10, and an increase in 1 unit is a doubling of risk. It does show also 10-year risk of biochemical recurrence, and that's obtained by combining the Prolaris score with the Capra-S score, the Capra surgical score. Here's an example of some patients' test results. So this patient was found to be less aggressive than average high risk. You can't order this test if their PSA is greater than 100, if they've already had androgen deprivation therapy, radiation therapy, if the RNA has been degraded. Here's some validation for the Prolaris score. To order this, I can't say it enough, make sure they sign the medical release form before leaving your clinic. You're going to fill out all of that information, demographics, send that off. You can send it via secure email or fax. The results will be available on their online portal, myriadpro.com. The results are generally back within 2 weeks. Cost again is $3,400. They do have that same Myriad promise. If the patient's out-of-pocket expense exceeds $375, they'll ask permission before running that test. And they also offer financial assistance programs. All right, so I got a couple tips for you if you're looking to order a lot of these tests in your clinic. Sometimes they make a mistake and they send the slides to your office. So what do? Well, you can have pathology department help you out, or I actually just order a few of the kits, like 2 or 3 of the kits from each company, and then I can put them on ice and send them out to the laboratories myself. Sometimes the pathology department have no idea what this test is. They've never seen it before and they don't know how to take care of it. You can actually call the company and they will either send them information, they'll send someone out to help them because there are certain ways that the specimens have to be cut. They always have to be on ice. If they get warm, the fixative can actually warp and make it more difficult for them to run the test. If your patient's uninsured, most of these companies, I think with the exception of one, have a lot of resources where they can help patients pay for these tests. So use all of the online portals that are available to you. You can use shared patient. In Epic, we have shared patient lists, so we create these lists. We keep track of these patients here. You can use shared calendars, pre-fill your forms. So if you have medical release forms, just scan those in and pre-fill them with all the information. It saves you a lot of time. Little reminders using technology. And keep in mind that logistical delays are always a possibility. So you've sent your order out to the pathology department, but sometimes they'll sit on it for a couple weeks. So keep that in mind. Even though it's a 14-day turnaround, I like to push them out 4 weeks, 6 weeks, just to make sure that we have all of that information available for them at their next appointment. So there are additional tests to consider here. The only test that you can run on TERP chips is the ERG and P10. We're looking at all kinds of different biomarkers. So, what was that? So what does the future hold? So hopefully, we'll just be able to run a blood test or urine test and say, hey, you're going to have prostate cancer, you do have prostate cancer, and this is exactly and precisely how we're going to treat it. But I think these tests can really help you advocate for your patients. So commercially available tests are rapidly evolving. Any questions?
You had the one test that said you can't send it on Friday.
Yes.
Okay. I would think
Apifiny.
none of those tests should be sent on Friday. I mean, are these labs open 24/7?
No, but some of them do service on Saturday. Yeah, but that's a good suggestion.
Because I would want to be the nurse that has to tell the patient we have to rebiopsy it because it was stuck in the mail.
Oh yeah. No, that'll be FedExed actually from the pathology departments. It's
Friday's
usually
such an iffy thing.
yeah. Yeah. Any other questions? Thank you for having me.